Hey guys, it's Dr. Josh, and today I wanted to talk about how you can deal with jiu-jitsu related injuries. And of course, this episode is going to be geared more towards those who practice jiu-jitsu, but I think a lot of the concepts can overlay in many other aspects of sports. So I've been doing jiu-jitsu now for over 10 years, give or take. I've been treating patients now for about 11 plus years. And so I have seen a lot of patients and I've seen a lot of roles and I've just seen a lot of different things. So I wanted to give you my expertise on a little bit about what you can do to help yourself when it comes to dealing with jiu-jitsu injuries or how to even avoid them in the first place. So as a sports practitioner, the first thing we say is that if a patient or if an athlete goes on the field or on the mat in this case and expect to not get injured, well, you shouldn't be there to begin with, okay? Every single sport has its inherent risk and jiu-jitsu is no exception. And especially when it comes to jiu-jitsu, it is actually a martial art called the gentle art, which again, it's not so gentle because it is a contact sport. It is really designed to break and destroy and dismantle joints. And so if you understand that concept right off the bat, then you'll understand that, the recovery process, the dealing with prevention of injuries or how to prevent injuries or what you can do on the mat, off the mat, before, after, I think will just give you a better understanding of what you can do to help yourself, right? And you have to understand that there's people who come, they go, and there's different body styles and all the other stuff, and we'll talk about that. So I think the first and easiest understanding when it comes to jiu-jitsu training is training smart. What does training smart mean? It means a various amount of things, but the first thing is let's talk about your training partners. Let's talk about your training intensity and let's talk about your training level, right? So your training partners have a lot to do, right? You are more than likely to get injured with a brand new white belt, or even if you're a white belt yourself, you're more than likely to get injured because your footwork is not there, your mechanics are there, your neurologic system is not necessarily in tune with what needs to be done. And then also, So knowing that right off the bat is like if you're a purple belt right now or a blue belt and you're training with a white belt who you want to kind of show up to, their standard of jiu-jitsu is totally different than your standard. Their rule sets are different. You've been there for 2 years. They've been there for 2 months, and they're finally starting to learn how to roll for the first time. So they may be doing different things. So you're more than likely to get injured with a newer, younger spazzer or white belt, so to speak, than you are with a seasoned veteran. And whether they're purple belt or brown belt or black belt, it doesn't really matter. You're more than likely to get injured with that newer person. So because they just don't understand the rules as much and they don't understand how to react and sometimes they're trying to go after things. Now, I'm not saying you should avoid these types of people. I truly believe that you should be rolling with all types of people. You should learn how to get into these situations so that you can get out of these situations. I think that's going to benefit your jiu-jitsu. But at the end of the day, if you're nursing an injury, if you're maybe don't feel comfortable or confident in your jiu-jitsu, that point, maybe you need to kind of hold back on that, or maybe you have to practice a different type of game, in order, maybe practice, top game. If you're somebody like myself who's 155, 160 pounds, maybe you want to play top game against a 280 pound guy, maybe you don't, I don't know, it's up to you, but you got to learn how to train smart and pick your right players. You should pick a bunch of right people, but you should also be cautious of how you roll, because each individual roll, if you have a brand new white belt who's a lot bigger than you, might be totally different than a brown belt who's much bigger than you, so just think about that. There is a safety rule in jiu-jitsu, and that is tap, right? It is a joint. If you're going to get hurt, there's a safety mechanism, and it's called tapping. Tap early. I know people they want their ego to get away, or they don't want their ego to get in the way, but it ends up getting in the way anyway. Who cares? You're there to train again, and live to die another day is what we say, okay? So if you can practice jiu-jitsu in a way that you can train and you can continue to train that's even better. Over, again, 10 years of rolling, I've done, wrestling for 4 or 5 years prior. I've had over 200 matches, and I've been in practice for 10 plus years. I have not seen very many catastrophic failures when it comes to breaking things and major sprains or strains. Like, that is common, but I haven't seen a lot of problems despite jiu-jitsu because people tend to tap early. So picking your right partner, somebody who's not going to crank on you, hopefully. And also, if they do crank on you, you can say verbally if possible and tap aggressively, right? A lot of people just tap like this. Give them a nice tap. Understand, say verbal and touch at the same time. So, live to die another day is our expression when it comes to that. When it comes to sports performance off the mat, what can you do? And this is a big problem that I see as a practitioner is people's mechanics get screwed up, right? So what most people do is because they now found jiu-jitsu and they love jiu-jitsu, they now train maybe 4 days a week of jiu-jitsu, and they were before, let's just say, working out 3 days a week and, doing whatever they do. Now that they're training 4 days a week, they maybe train weightlifting 0 days a week because they have a busy schedule or something going on. I think that's the biggest problem that you can do is stop weightlifting and weight training. Weight training, I'm not saying you need to go out there and lift 500 pounds or you need to spend an hour there, but if you could spend 20, 30 minutes getting a joint into the right position, you can help the alignment, you can help blood flow, you can help strength and conditioning, really, fixing the tendons and stuff like that and really adhering the tendons together. I think that is a really, really important thing. And when it comes to the research, there is a lot of evidence to suggest that strength training actually reduces more injuries than stretching, than proprioceptive or neuromuscular or, balance training or any other thing. Strength training is the best. So if you ask me, I'm going to tell you got to do an upper body and a lower body 2 days a week. If you're training 4, I would really encourage 3 if you can, but upper and a lower, try to get 2 20, 30, 40-minute sessions a week. Even if it means you have to cut down jiu-jitsu once a week, I really think that you'll end up being better off in the long run doing 3 days a week of jiu-jitsu and 2 days a week of weight training than to do 4 days a week of jiu-jitsu and 1 day or 0 days a week of weight training. So I think that is another thing. Of course, we can always talk about flexibility and mobility. I think this topic gets a huge notoriety, but it's actually something that is important, but I really also think that it's overemphasized. And I know I contradicted myself a little bit there, but again, the research says that strength training is better than any other form. So I think a lot of people overemphasize stretching. Now, I'm not saying stretching is not okay and you should stretch and you should have mobility. And I do think that will help you with submissions and escapes and, getting more pliable and helping yourself in terms of injury prevention. But most people will just stretch, and they forget about the strength training part that I just mentioned and that research that I just mentioned, and they overemphasize stretching as if it's the end all be all. All you have to do is stretch and do jiu-jitsu and life is good, right? No, it's not just that simple. You need to stretch, you need to strengthen, you need to do jiu-jitsu, you need to train smart, and you need to do a lot of these other things. Finally, last but not least, obviously, as a sports practitioner, somebody who treats patients for a living, one of the best things you can do is outside of all that stuff, outside of working out, is you can get massages, you can go to see a therapist, you can do mobility training on your own, you can do sports-specific exercises and things like that. I think that is important. Make sure you warm up properly. Obviously, that's important as well. But also, if you do feel a little banged up and busted up a little bit, and maybe you're milking some injuries, what are you going to do outside of the training patterns? Are you going to reduce your jiu-jitsu days and increase your strength training days? Are you going to do more rehab, more mobility? Are you going to go see a professional to go get that thing examined or looked at that you've been waiting for after 6 months that's still lingering around? what are you going to do about that? I think this is important, and these are the things that most people don't talk about when it comes to, how to prevent jiu-jitsu injuries. I also like to touch on one more thing, and this is more for the coaches out there. I think that, I know for a fact that the traditional style of jiu-jitsu, of like warming up, is still the same. It's like people run in a circle over and over and over. And it's like the first thing they do when they get to the end of the line is like forward rolls. It's like these people are coming off of sitting for 8 hours, or maybe like you're coming off of like a full day of work, and you have to run in a circle one direction where like it's just putting stress on your left knee, and then you tell a person to like jump and roll and impact their spine. This isn't necessarily your fault if you're watching this. It's just the old school tradition of like what needs to be done. But maybe you have to show up to the class a little early and do more dynamic warm-ups, joint mobilizations, and getting yourself primed and ready for these exercises prior to your actual training session. And now coaches, are coaches. Let me just say that they're great at jiu-jitsu. They're great at what they do. I'm not going to tell them how to coach, but I am going to say from a sports performance and joint and musculoskeletal dysfunction type of positioning, like your body is not ready for these impacts right away to essentially just jump and like hit your spine on the ground. There should be sort of joint mobility going on, and if you are somebody watching this, maybe you want to get to class a little bit earlier and do some sort of dynamic exercises, dynamic warm-ups prior to your rolling or anything like that, or even your warm-up. So warm up properly, make sure you get a decent sweat in prior to. I like to warm up with like guard passing and just more dynamic functional stuff, and maybe some joint mobility after or slightly before, and then I like to go into my drilling. I rather just drill and then light roll and flow roll, but that's just my style. So whatever works for you guys. But I really just think that when it comes to dealing with jiu-jitsu injuries, a lot of this stuff that I just mentioned needs to be on the table. And it sounds like a lot, but it's really not that much. 30 minutes, 20 minutes, even 40 minutes a week should be enough to get a good quality strength training in. It may not be perfect, but at least it's something. You need to get some sort of strength training in, some little flexibility. You need to lick your wounds when you need to lick your wounds, tap early, pick your right training partners. These are all part of the game. And if you want to do jiu-jitsu for more than a year, more than 5 years, more than 10 years, you're going to have to do all of these. So thanks again for watching, guys. I'm Dr. Josh. If you have any questions, feel free to reach out. Looking forward to seeing you, and thanks for watching.